take a minute and think about how it feels waiting for something you desperately want. Now, what if this was something you literally couldn't live without? Organ donation is a selfless way to give back to others, make a difference, and give someone the second chance at life. Unfortunately, the number of patients waiting for an organ far exceeds the number of available donors. June 12, 2013, the ProQuest staff explained that a 10-year-old by the name Sarah currently suffers from cystic fibrosis. If she doesn't get a new set of lungs within the next couple weeks, she will likely die. Now, the sad part about this is that the likelihood of her getting a new set of lungs in time is nearly zero. The U.S. Department of Health and Human Services says that there are 120,648 patients on the waiting list, and this continually grows every day. Just 18 of them will die daily, when only one donor could save more than 8 lives. Organ donation is the greatest gift of all. It's the gift of life. But how can we help resolve this growing issue? With legalizing organ sales. So today I'll be discussing what is this, or how would it work, some of the arguments against it, and how beneficial it'll be. So first, many of you may be wondering, well, what is legalizing organ sales, or how would this work? It'd be the same system like today, where you track and match patients according to your blood type, except donors are going to be paid to donate. This is going to give people more of an incentive to donate with this financial return. And the effect of this is that there will be no more organ shortages. September 28, 2012, Dr. Braden Mann discussed legalizing organ sales to boost donation rates. He said people respond to anything with a financial incentive. Now, there's also going to be a third party. The hospital will act as that third party. And what this means is that the hospital will pay the donor for the organ to give to that recipient. Now, the cost that the hospital has to pay for that organ is going to be covered by the recipient's insurance. This is no different than today's system, where the recipient has to pay for the transplant, and that's covered by insurance. Dr. Manns also said that we're not talking about buying and selling organs in a shady area. We're talking about a third-party regulator that will offer fair and equal compensation. Now, with that being said, most will shy away from such an abstract idea, especially with some of the arguments of the proposition's validity. So that brings me to my second point. Let's take a look at some of the misconceptions of organ donation in general, and some of the arguments of legalizing organ sales. So first, many assume that it's against their religion to donate. But according to the homepage of Organ Donor, it's actually not true. Many religions are actually compliant with organ donating. So if you're unsure of your faith with donating, you can check it out there. Next, many assume that legalizing organ sales is going to favor the rich over the poor. But this is clearly not true, and the cost is going to be covered by insurance, and there will be that third-party regulator that makes sure everything is fair and equal. And anyone can donate, whether you're rich or you're poor, so everyone gets a return, so it wouldn't favor the rich or the poor. Many would say that, well, that's inhumane. But is it really inhumane if it's saving more lives than we do today? And wouldn't it be inhumane not to take a step further to boost donation rates? The last argument I'll be discussing is age. Many assume that they're too old to donate. This is also just a misconception because it's based on medical criteria, not necessarily your age. May 3rd, 2013, the Mayo Clinic confirmed that there's been many successful donations from people well into their 70s and their 80s. So now that we've put some of those fires out, let's dive into some of the benefits that legalizing organ sales will have. There's going to be less lost lives. There's going to be so many people wanting to donate now because of this financial incentive. And LinkedIn magazine states that in Iran, it's legal to sell a kidney for profit. Iran currently has no patients anguishing on their waiting list. Unlike ours, we have a very large gap between the number of patients waiting and the number of available donors, like I mentioned earlier. So Iranians have clearly solved their problem of organ shortages with legalizing organ sales. And again, it's going to be no direct consequence for the recipient, like I stated earlier in the speech. There's going to be a third party that will regulate everything, and it will be covered by the recipient's insurance. So knowing all the benefits that legalizing organ sales can have, I hope your mind has changed as much as mine first did. Before doing research for this speech, I never thought or considered me becoming an organ donor. However, knowing the sheer number of lives lost and having the incentive is a no-brainer to register. I now plan to be one, and I hope y'all will join me if you have not already. If you really think about it, are we going to be using our organs as we're buried underground? The answer is obviously no, so instead of just letting them rot, why not let them flourish in the life of another? Help save lives while you're gone, and give someone a second chance at life, like the 10-year-old Sarah that I mentioned earlier. We've got to do something drastic to change these drastic numbers, especially considering a new name is added to the list just every 10 minutes. You can change these numbers by registering to become an organ donor the next time you renew your license or on their homepage. And if there's ever a piece of legislator to vote for or against legalizing organ sales, I hope that after hearing all this, you all will be for legalizing organ sales so that together we can save even more lives than we do today. Thank you.